What if I told you that the headache you've been blaming on stress might not actually be coming from your head at all? Think about that for a second. Millions of people wake up every morning with headaches. They take painkillers. They drink more water. They try to reduce stress. Some even spend years searching for answers. Yet the pain keeps coming back. The cycle repeats itself again and again. Let me be clear. If your headaches seem to start at the base of your skull, spread toward your forehead, or appear after long hours at a desk, there may be something much bigger going on than simple stress or fatigue. Here is the truth. One of the most overlooked causes of recurring headaches is a condition called cervicogenic headache. And by the end of this video, you'll understand why ignoring your neck could be the reason your headaches never truly go away. Most people think headaches originate in the brain. It sounds logical. Your head hurts, so the problem must be in your head, right? Not necessarily. The brain itself doesn't actually feel pain the way many people assume. Instead, pain often comes from surrounding structures such as muscles, blood vessels, nerves, and connective tissues. In the case of cervicogenic headaches, the source may be located much lower. Nobody tells you this. The upper neck and the head share complex nerve pathways. When certain joints, muscles, or nerves in the neck become irritated, the brain can misinterpret those signals and perceive them as pain in the head. That is why so many people spend years treating symptoms while completely missing the true source. The headache is real. The suffering is real. But the origin of the problem may be hiding where few people think to look. Imagine you are sitting at your desk right now. You've already spent 4 hours staring at a screen. Your shoulders are rounded forward. Your neck is slightly bent. You barely notice it. As the day progresses, your neck begins to feel tight. Nothing dramatic, just a little stiffness, a little discomfort, easy to ignore. Then slowly, almost without warning, a dull ache begins near the base of your skull. An hour later, the pain spreads. It moves behind one eye. It reaches the temple. Now you are rubbing your forehead and wondering why another headache has appeared. You blame stress, maybe dehydration, maybe lack of sleep. But here is the twist. The real culprit may have been your neck position all along. And if that sounds familiar, you are far from alone. Let's break this down in simple terms. The word cervicogenic literally means originating from the cervical spine. The cervical spine is the section of your backbone located in your neck. It contains vertebrae, joints, discs, muscles, ligaments, and nerves that work together to support your head and allow movement. When these structures become irritated, inflamed, restricted, or injured, they can generate pain signals. Those signals travel through shared nerve pathways into the head, creating what feels like a headache. Here is what makes this condition tricky. The pain is usually felt in the head, but the source isn't there. It is a bit like hearing an alarm in one room when the problem started in another room entirely. Unless you find the source, the alarm keeps coming back. So what causes cervicogenic headaches? One major factor is poor posture. Modern life has created a perfect storm. Smartphones, laptops, tablets. Hours of sitting, hours of looking down, hours of leaning forward. Your neck was never designed to spend most of the day in that position. Then there are injuries. Whiplash from car accidents is one of the most common triggers. Even injuries that happened years ago can leave lasting changes in neck mechanics that continue to generate headaches long after the original incident. Age-related wear and tear can also contribute. The joints of the neck naturally experience stress over time. For some individuals, those changes can irritate nearby nerves and trigger recurring pain patterns. Here is the truth. Many cervicogenic headaches don't appear overnight. They often develop slowly, quietly, and gradually until one day the symptoms become impossible to ignore. This is where things get interesting. Unlike migraines, cervicogenic headaches often begin in the neck or the base of the skull. The pain frequently travels upward in a predictable pattern. Many people describe it as a steady ache rather than a throbbing sensation. Another clue is limited neck movement. Turning your head may feel stiff or uncomfortable. Looking up might aggravate symptoms. Certain neck positions may trigger pain almost immediately. Some individuals experience pain behind one eye, around one temple, or on one side of the head. Because of this, cervicogenic headaches are often confused with migraines. Let me be clear. Not every headache involving neck pain is cervicogenic. But when headaches consistently appear alongside neck stiffness, reduced mobility, or posture-related discomfort, it is a clue worth paying attention to. Have you ever noticed that some headaches disappear with medication while others keep coming back? There is a reason for that. Painkillers may temporarily reduce pain signals. They can help manage symptoms, but they don't necessarily fix the mechanical dysfunction that is creating the problem in the first place. Think of it this way. Imagine your smoke alarm keeps going off because there is an actual fire. Removing the battery might stop the noise temporarily, but the fire continues to burn. That is what happens when treatment focuses only on symptoms. Nobody likes hearing this. But if neck dysfunction is the true driver of your headaches, long-term improvement usually requires addressing the neck itself rather than simply masking pain. Now let's focus on solutions. One of the most effective approaches involves improving neck mobility and posture. Small adjustments repeated consistently often outperform dramatic changes that only last a few days. Physical therapy is frequently recommended because it targets the root causes of dysfunction. Therapists can identify movement restrictions, muscle imbalances, and posture problems that may be contributing to symptoms. Regular movement throughout the day can also make a major difference. Human bodies were built to move. Sitting motionless for hours places enormous stress on the neck and upper back. For many people, the combination of movement, strengthening, posture correction, and professional guidance creates meaningful improvement over time. Not instantly, but steadily. Let's have an honest conversation. The internet is filled with promises, miracle stretches, instant fixes, secret techniques, 30-second cures. Most of them sound amazing. The problem is that reality doesn't work that way. Recovery from cervicogenic headaches often requires patience and consistency. It may involve changing daily habits that have been repeated for years. That is not always exciting, but it is often effective. Here is the encouraging news. When people finally identify the true source of their headaches, they frequently experience progress they never thought possible. Less pain, better sleep, better concentration, better quality of life. That is why understanding the cause matters so much. So let's end with a powerful idea. Your headache may not be your enemy. It may be your body's warning signal, a message, a clue, an attempt to tell you that something deeper requires attention. If you've spent years chasing headaches without answers, maybe it is time to ask a different question. Instead of focusing only on where the pain appears, start asking where it might actually be coming from. Here is the truth. Cervicogenic headaches are often misunderstood, frequently overlooked, and surprisingly common. But once the neck-head connection becomes clear, the path forward often becomes much easier to understand. This video is for educational purposes only and is not a substitute for professional medical advice. If your headaches are severe, sudden worsening, or accompanied by unusual symptoms, seek medical evaluation immediately. If you learned something new today, subscribe for more evidence-based health content. Leave a comment below and tell us, have you ever noticed a connection between your neck pain and your headaches? Your experience could help someone else who is searching for answers. And remember, sometimes the place you feel the pain isn't where the problem actually begins.